Tuberculosis, okay, tuberculosis caused by Mycobacterium tuberculosis, contagious infection that attacks lung, can be spread to the brain and spine. Type latent TB and active TB. What is the symptoms you are having TB, tuberculosis? Cough, chest pain, coughing up blood, and weight loss. Weight loss. And this disease, when you sneeze, or when the person with TB sneeze, the tuberculosis can be spread by a or the saliva. Okay, we have medication for tuberculosis. HIV and AIDS. HIV continues to be a major global public health issue. Until today, more than 30 million people lives with AIDS. Okay. Uh, Today is much better compared to maybe 30 years ago or 35 years ago, back in 1980s. Uh, we do not have medication for people to live with HIV. Today, what they have, uh, lifelong antiretroviral therapy or ART. So this method of healthcare help people with HIV to live longer. Okay, to live longer. They can live with HIV today with healthcare, with proper medication. Yes, people can still live with HIV. HIV, human immunodeficiency virus, it attacks cell that help body to fight infection. Okay, it attacks our immune system. If one people get infected with HIV, the HIV will attack the immunity system. When the immunity system is attacked by the HIV, the people will easily get sick. Okay? Easily for them to get sick. Okay? Even simple flu can kill people with HIV. It's spread by contact with certain bodily fluid of person with HIV, mainly when they have unprotected sex. Okay, sex without condom or HIV medication to prevent will make the HIV infection happen. Okay, when one person with HIV had unprotected sex with person without HIV, the risk of infection will be there. Okay, and also beside the bodily fluid, exchange of bodily fluid when they have sex, uh, injection equipment, if they share between the addicts, could also cause the HIV infection. HIV, if untreated later, will lead to the disease AIDS. Okay, AIDS. The human cannot cure HIV yet. No effective HIV cure exists until today. If people have HIV or diagnosed as HIV positive, they must live with HIV until they die. Okay, for until today we do not have cure for HIV, but we have some kind of method to prolong the survival time for the HIV positive people. Where did the HIV come from? Actually, HIV infection in humans came out of chimpanzee, originated in chimpanzee. Version for chimpanzee with this immunodeficiency virus is known as simian immunodeficiency virus. Okay, how this chimpanzee disease can infect human? Okay, human come close contact with chimpanzee. When human come close contact with chimpanzee, what happen? They hunt the chimpanzee, they take the meat of the chimpanzee, they eat the meat, and also maybe when they did such thing to the chimpanzee, the infected blood of chimpanzee, the chimpanzee with HIV may be transmitted to the human because fluid in the blood can infect the human. Studies show that HIV may have jumped from chimpanzee to human as far back as the late 1800s. Over decades, HIV slowly spread out of Africa and to all over the world. In United States, HIV has existed since mid to late 1970. SARS. SARS is a severe acute respiratory syndrome. Is a disease caused by a SARS associated with coronavirus. It is airborne. Even a small droplets of saliva could infect the people. Okay, it's same like other cold or influenza, flu. Okay, that's how the SARS infect people. Okay, in 2002, okay, even today, actually when people is more global, they go from place to place, airport to airport, this also make them expose themselves to the disease like SARS. Okay, if the disease started, for example, in Hong Kong, okay, a person in Malaysia, this person went to Hong Kong, get infected, boarding a flight to the Malaysia, after landed in Malaysia, and then infect people in Malaysia. That's how the disease can spread Hong Kong to Malaysia. So all over the world. In the end, all over the world. We cannot stop people, stop flying, don't flying. We cannot say that. People will still go boarding on flight and fly, and along the way expose themselves and to others about the disease. The incubation about 2 until 7 days, maybe as long as 10 days. The first symptoms, fever. It may also be accompanied by other symptoms including headache, malaise, and muscle pain. And after that, shortness of breath, dyspnea, and also hypoxemia. Okay, that's what SARS did to you. Ebola is a deadly disease. Occasional outbreaks occur mainly in Africa continent. Okay, most commonly affects people and non-human animals such as monkey, gorillas, and chimpanzees. Okay, the symptoms is severe actually. Okay, how it was spread? Contact between blood, body fluids, tissue of animals, infected tissue animals, infected blood, infected body fluids, and then if you have contact with person who is sick or with the one who has died from EVD, so you can get this disease too. Symptoms may appear from day 2 until day 21 after you contacted with the virus, and the symptoms including fatigue, muscle pain, fever, and also vomiting. Okay, people get sicker, and also in certain cases, blood come out of their body cavity. Okay, bleeding happen, and the blood diffuse out of the people or the patient, Ebola patient body cavity. Prevention of infectious disease. Actually, some infectious disease can be prevented by using vaccine and vaccination. Okay, like in earlier slide, we talked about smallpox. Okay, smallpox kill many people, millions of people, and it can be tackled or it can be prevented by giving vaccine to the population. Okay, vaccination, what they call it, immunity. Herd immunity is achieved when up to 70 to 80% of population get vaccinated. Okay, so first you must have vaccine. Second, you must have vaccination program. Okay, today, COVID-19, as we speak, the vaccines are available, and we should take vaccination. Okay, we should participate in vaccination. We should get the vaccine for ourselves and for others. This is to prevent the infectious disease. Besides vaccine, you can also reduce your risk by avoiding contact with infected people. Okay, today, as we speak, also a global pandemic, COVID-19, when we actually avoid contact with people, infected people will be isolated in hospital or any medical facility, okay, for maybe 1 week, maybe 2 weeks. And then we were advised by the KKM to wash our hands by using soap and water. If you do not have soap and water available, you may use hand sanitizer. We should also use face mask whenever we go out, whenever we have contact with other people. We should put our face mask on. Okay, and also they advise you to keep your distance. Okay, when you sneeze, please cover your nose and your mouth. Okay, and if possible, disinfect the surface regularly and wash your hand. Use hand sanitizer, and this help us to prevent contacting with infectious disease. Okay, thank you. That's all our topic for today, which is infectious disease.